Let's talk about joint subluxation. So this here is the Brighton criteria, which you can see there. This is criteria used to diagnose hypermobility spectrum disorder and hypermobile Ehlers-Danlos syndrome. And you can see here one of the minor criteria is dislocation or subluxation in more than one joint or in one joint on more than one occasion. And what I've found in talking to some of my patients is that we have a good understanding of dislocation, but not as good of an understanding of subluxation until you describe some of your pain and symptoms to a professional like me, and we are able to identify it. So this is what a normal shoulder joint looks like. This is the head of your humerus, and this is the socket part of that joint, so where the humerus comes into what's called the glenoid. And there's this nice normal arc, this smooth arc line. That's a normal shoulder joint. And this is what it looks like when it's subluxated. So on an x-ray, we can see how this arc is interrupted here and then it hops up a little bit to go to the glenoid surface. So the head of the humerus is still in contact with the glenoid. It's just a little bit off center, and that can cause pain and pinching when you move your shoulder around. And just so that we can see the difference, this is an example of a dislocation as opposed to a subluxation, where the joint surfaces actually come apart from one another and are no longer in contact.